amount of pressure the society put on my parents to say, you guys are doing something wrong. No one's going to want your daughter's hand in marriage because she's going to be way educated than the boy. And I'm like, I don't know.
I think especially coming from our culture where it's very like, don't show anything of yours to anyone, It's so, like even things like breast examinations, it's just like, ooh, like don't talk about it, that's very private, that kind of thing.
You haven't talked to GP because it's a new thing that they've rolled, because they've realized so many young women don't come to it because they don't want that test. So
exactly, because it can be scary and not people know what it is and how it's done.
Like, Shahi, like, do you want to come out and have a cup of coffee? I'm like, no, I don't have time, and literally crying. And it was.
You need to Google your symptoms and then be prepared for it and then go to your doctor.
Yeah.
Do not Google symptoms.
Google is not a doctor. Respecting the traditional custodians, we acknowledge the Turrbal and Kaurna peoples as the original inhabitants of the lands now known as Brisbane and Adelaide. We pay our respects to their elders past, present and emerging, and recognize their enduring connection to the land, waters and culture.
Hello everyone, thank you so much for joining us on the 11th episode of Brown Girls Down Under. I cannot believe we've done 10 episodes. The time has gone so quickly. But today we've got a very interesting episode with an interesting guest, which I'm very much looking forward to. But to give you guys some brief introductions, I'm Deshani. I'm joining the podcast from Adelaide, South Australia, and we've got two special people. Well, Shonali's also special, but we've got an extra special person today.
Yes.
Hi, Shonali.
Hi, Desh. Hi, everyone. And yes, thank you so much for joining us on the last 10 episodes. We really appreciate your support. But as a very special guest, as Desh mentioned, we've got a very special guest on our 11th episode today.
Extra special,
and that is my beautiful friend, Dr. Shahana here.
Hey, Shahana, welcome to the pod.
Thank you for having me.
So Shahi and I'm going to be calling her Shahi because that's what everyone knows her as. Yes. So we've been friends for 12 years now? Yeah, about 12 years.
Wow, 12 years.
Yes. So it's funny how we actually became friends because my best friend...
That's a relationship right there.
Yeah, I know, right?
It does feel like
it. Does, yeah. So my best friend in Melbourne and Shahi were actually housemates. And that's how we met. And then we found out that she and I share the same birthday, the 22nd of March. Yeah. I know.
And that's how we've always been like,
and I feel like our personalities are quite similar because of that. Yeah. Because I don't know, maybe it's something to do with our star signs, but we're so similar. So that's why we've always just really bonded. And I feel like we've always followed each other where we went, right?
Especially me, initially I was in Cairns and then I came to Brisbane. And we met quite often.
Yeah, and we've always been living really close to each other. Yeah, even now we're 15 minutes apart.
And before we were literally
a street away from each other.
And we could see each other.
Yeah. We used to call each other from the balcony. So it's been very wholesome relationship. So I honestly couldn't think of anyone better that we could have as our first guest. So we're very happy to have her here. So Shahi is a pediatric doctor in training, I should say that. And she has a lot of good information that I feel like is going to help everyone, and I feel like it's going to be such an informative episode today.
Yeah. Oh, well, I also wanted to wish you a happy belated birthday then.
For both of us, yes. So I'll let Shahi do the honors and introduce herself a little bit and maybe talk a little bit about her journey in getting here.
Okay, so I am a mom of two. That's my biggest label and the proudest label I can have. But before I got here, I left Sri Lanka when I was 17. I did my O-levels as a Cambridge student and then did 6 months of a diploma course at Monash College that was in Sri Lanka. I'm not sure if these things have changed now. And then I came to Australia and did a Bachelor's of Biomedical Sciences, which is a 3-year degree. I used my credits because you can use credits to skip years when you want to do medicine, because it was definitely a very prolonged medical journey that I've taken. But then I was able to skip a year and a half with the credits I learned from my first degree, which is biomedical sciences, and then I got into James Cook University, which is my medical degree. I completed that in 2019, and since then I've been a medical doctor. I've been training most of my life with both adult medicine and pediatric medicine, but in the last 2 years I've realized that pediatric medicine is what I have passion about, and now I'm as a pediatric training doctor.
Yes, and you've been through quite the journey, I think, with
journey,
there's placements and everything. I remember.
I think that's one of the reasons I chose James Cook University, which is all the way up in the north of Queensland. And it has a lot to do with tropical medicine, like in Sri Lanka, which is why I chose JCU. One of the good things of JCU was that they put us into these placements all over Australia, and most of the time you're by yourself as a doctor in the hospital. Even though you're not a doctor, you are trained as a doctor. So I've done placements in Thursday Island for 3 months,
which is very
rural. There's no vehicles. I would use a cycle early in the morning to go to hospital, and and I'd be fishing with my consultants after board rounds, and very interesting journey to become a doctor. But I would never take it back.
Have you always wanted to be a doctor from a very young age?
I think yes. I think I've always, maybe it's something our parents has put into us, but I have always grown thinking, you know what, I really want to be a doctor. But my mom used to say that I was always willing to help people, like even if a maid has cut her finger or something at home, I'd rush with my first aid box, and I was never afraid of blood. Like I would never, I'll just go in and I'll wash her finger, and apparently I'll band-aid it, even though I don't know how I'm doing it. But this was when I was 7, so mom always thought that I had that helping nature, and she knew that I would choose something in the medical profession. But it was never like, you have to be a doctor, but I felt like that was part of, like, it was kind of chosen for me. I don't know, that's what
I feel like that was your calling, and
you, as you said, you've always been a sort of like a nurturing person who's always wanting to take care of people. I just wanted to ask you, like, have you also, because studying medicine, becoming a doctor, that's a big decision, because that's like years and years of commitment there, years and years of like hard work, and actually years of like studying to get to where you are now. And I think, and that's also like there's sort of like pressure that you get from like our culture as well, like all of our parents, they would love their kids to be doctors, and but I think, and I got that from my parents as well. It's like the first thing was like, would you like to be a doctor or an engineer? But I think now that I think about it, I'm just glad that I didn't choose it, because I think, yes, it's hard work, but if you haven't got that sort of passion for it, then it's gonna make it a bit hard to commit to all those years of studying. But how was that for you? Like, have you also enjoyed that bit of it?
I think that's a really good topic to talk about, because quite often I've got friends' kids, they'll message like, I want to be a doctor, like, is this what I want to do? So where I am right now, with the years of sacrifice, especially, I think Shahana would know, when I was, in uni, doing my degree and studying for exams and things, it's very stressful. Most of my teenage year to well into the mid-20s was spent on assignments, studying, preparing for OSCEs, and doing placements. Yes, I did choose a university to do medicine, which was very flexible, because I did long distance relationship while I was doing medicine, and I was able to travel quite often to Sri Lanka. But it's a huge sacrifice. Like whatever that I've gone through right now, looking back, I would always encourage anyone who wants to do medicine to know that it's a sacrifice, and if you're willing to do that sacrifice, then choose it. Because if you do medicine for the wrong reasons, you end up being burnt out, and you'll look back and you'll be like, why did I do this? Because right now, after going through all that hard work, and I look back now, I'm a mom, I've got my husband close to me, I'm not doing long distance anymore. It was a very difficult couple of years, but I'm very grateful because of obviously the job stability, the pay, and obviously looking back, I'm happy with the way my job is treating me, and you know, I get to choose my hours, and I'm working part-time right now before I go full-time again. So there are all these perks after coming to the other end of it, but it is not easy. So the studying is really hard, but I feel like when looking back, I wish I realized that it was not the end of the world. Like for me, when I was going through medical school, I thought, if I don't pass, this is the end of the world. If I don't become a doctor, this is the end of the world. Because these are pressures that we put on ourselves. So I remember...
Yeah, and also you're not like completely mature at that stage as well, right? And for you to have that mindset at that age in your life, it's completely normal, because that's the biggest thing in your life.
In my life, and our parents are paying so much money.
So much pressure on you,
so much pressure, because
right?
you know, as an international student, like my parents paid so much, and I'm like, oh, I can't afford to fail a unit. And then at the same time, I remember having all these moments where I'm at home studying with all these notes and printouts, and I'm scrolling through Facebook, and I see my friends, you know, having fun. They have parties to go to, and I'm like, what the hell am I doing with my life? Like those kind of
formal you get,
and then like,
oh, that must be really.
It was really tough, and especially because I was doing long distance. Like our kid and I, my husband, like we had so much of like, you know, disagreements. Like, oh, you know, is this worth it? But he would always remind me, it's like, you know what, there's going to be the light at the end of the tunnel. And now that I'm there at the end of the tunnel, obviously not 100%, but I feel like, oh my God, I'm so glad I didn't give up. So what I would definitely tell people is, if they want to choose medicine, there's a lot of perks around it, but try to do medicine for the right reason. If you're passionate, if you feel like you want to help people, and if that gives you that the gratification of doing it, choose medicine, but not for any other reasons. Don't choose it for money, don't choose it for the name label,
status,
the status, or because your parents are forcing you. Because I have seen friends who've gone through medical school, and mid halfway through, these are kids who got all A's and HDs, burnt out and give up because they've chosen for the wrong, like, you know, they've just realized, I can't keep up with the demand.
Yeah, because those reasons aren't going to help them in the long run of like staying committed to it. Because it's a, and how many years is the whole whole journey?
So medicine at James Cook University is 6 years, but because I did a 3-year biomedical degree, I was able to use units out of that, and so I was able to finish medicine in 5 years. It is quite long though. It's still a long time.
Definitely.
And especially when you're just, you know, away from family, away from your partner, and trying to, like, you know, go through like, no, I can do it. It's the last few years. But now looking back, I'm like, oh my God, I don't think I'll ever, like, I wouldn't discourage my kids to do medicine, but I'll just put it out there and openly say, these are the sacrifices you'll need to do, because you cannot turn around. Like that's what happened with my family. Like my mom and dad never forced me to do medicine, so I couldn't go back and say, you made me do this. They always said it's an option, and we're happy to pay for it, and I'm grateful that they paid for it. And I was like, this is my passion, so I'm going to, you know, continue with it. But don't get me wrong, it is hard, but always remember, if you choose it for the right reasons, you'll feel like, you know, it's the best thing you've ever done. It's worth it.
Yeah, I remember, like, when you said that, I remember I had a friend whose, like, older sister was studying to get into, like, medical faculties in Sri Lanka. And she was very studious, because you need to be, right? You need to be studying all the time and be focused. But I remember, because the exam process in Sri Lanka is a bit tougher as well. So I remember she failed the first time, but then she was so desperate and she really wanted to get into medicine. So I remember she used to have like these photos of dying patients in front of like her desk, and I'm like, oh my God, this girl is so committed.
So for me,
and I'm like, I don't think she can do anything but be a doctor. You know
for me, my commitments, like I had these big frames of my boarding pass, like, you know, to know that I'm going back home, because every holiday I would go back home, and that was my like, I need to study and get all A's, and so that I'll be happy. But these are little pressures we put on ourselves. And I had really good friends in medical school who would have an exam next week, like on a Tuesday, and she'd go on a hike on a Sunday. And in my head, I couldn't believe that. Like, I was like, what the hell? Like, whereas for me, if there was an exam on Tuesday, I'd be literally studying the whole weekend, eating on the bed, like, literally studying 24 hours. But now looking back, I'm like, oh my God, that's not the right balance. Like, that was really unnecessary.
Yeah, I think it's also like in Sri Lanka, you're not encouraged on the sort of having to have a balanced lifestyle, whereas you're always encouraged to work hard and hard until you reach the goal. Whereas I feel like in the Australian sort of culture, you are encouraged to do more sports. You're encouraged to lead a more active lifestyle,
have a more well-rounded personality.
Because I feel like you would retain all that information better when you're studying. If you're a happier person, unless like when you're stressed and you're like trying to remember stuff. And I remember this because when I was sharing the house with Srini, she'd cook for me and she'll bring the lunch like and dinner and all into my room while I'm studying. Yeah, she was like the best housemaid, and she'll like, and she's also my best friend, so she'll be like, Shani, like, you know, do you want to come out and have a cup of coffee? I'm like, no, I don't have time, and literally crying. And it was, I think now looking back, I just put so much pressure on myself. But yes, I think I needed to end up becoming a doctor because those exams are really hard. But
and you're gonna have all this also, especially when you're an international student. And I think that's something every international student can relate to. Is that your parents have sacrificed so much for you to be here, so you can't afford to be distracted or fail.
Now looking back, if in case my kids decide to go somewhere else to study, and if they are international, I'll literally let them know that, you know, I need you to be a happy student. Like, you know, I don't mind you getting C's if you're still happy. Because at the end of the day, now I'm thinking back, I don't think any of my patients come and ask me if I got a HD or a distinction.
That's the thing. You know what I mean? None of that matters anymore.
None of that matters because, like, you know, they would be like, oh, did you pass that assignment in your last year? Like,
oh, sorry, you can't treat me anymore because you got a C.
Exactly.
Yes, I need to see your transcripts before you actually send them.
Exactly. How funny would it be? Because so I feel like my little thing I tell myself is, I'm really happy where I am right now, but if I could do it a second time, I'd tell Shahana, just relax. Like, you know, it's not the end of the world.
So yes, Shahi, you've spoken about how tough it was to get where you were. And now that you're finally here, what kind of challenges do you face in the real world, in your career? And obviously you mentioned you're a mom, like work-life balance. What are the challenges you face on a day-to-day basis?
So I feel like starting from when I became an intern and started working here as a doctor, I feel like one of the biggest things that I came across, even though we've heard this through like different videos and audios, people doing podcasts about racism, and especially given that I'm a Muslim here with the name that's, you know, Sri Lankan name, I felt like there is this little bit of subtle racism that goes across. That when you're a doctor, you're working and your patients are like, oh, are you my doctor? Or like, you know, they confuse you to a nurse. One of my first experiences, this was when I was like a junior doctor. I signed up for a gym class, and they asked me what my profession was, and I don't go around telling everyone I'm a doctor, so I started working in the health industry. And this person on the reception just assumed I was a nurse. And in my head, I was like, oh, I need to correct it. And obviously I was like, oh, I'm sorry, I'm actually a doctor. And I corrected it. I feel like because I think the person on the other end just assumed, looking at my skin color, I'm a woman, what else could she be? So what I would just say is these kind of little things that happen throughout your life, you kind of just put away and think, oh, you know what, it's not my battle to fight. But we have worked really hard to come where we are. And I've worked really hard to come where we are, and I'm in no position putting nurses lower. I'm honestly think my nurses and the team I work with in my hospital work way harder and sometimes more close with patients than we do. But when another person assumes, they look at your color and think, oh, you know what, I think you're a nurse, is what they accept of you. That is what they think. But what I could achieve is my capability. I don't think, and sometimes I'm so used to, in the brown culture, girls, they would be like, just put it under the rug, don't talk about it, don't make a fuss.
Yeah.
But you know what? That day I was like, I just said, no, sorry, I'm actually a doctor.
I'm not having it.
I'm not having it. And I feel like when I did that, and that was one of the first times I actually spoke up to myself, and I was like, oh yeah. Like, I don't have to just, just because someone else laid down. Exactly.
Yeah.
Just say. So I feel like I've got that a couple of times where, and that was me as a junior doctor, and I've worked with consultants who are, way, way older than me and way more senior. And they've literally told me that, oh, Shahana, like I go in with a medical student who's a male, but they assume that he is the consultant and I'm the nurse. And I'm like, because I did bring this up with one of my colleagues as well, and I'm like, that's just, it's just sad. And
so we've spoken about this in a few episodes as well, right, Desh? Like the unconscious biases that we have. Immediately we think like, oh, a female is a nurse, a male is a doctor. Or like even with teaching, like a female is a teacher, like male teachers are unheard of.
Exactly.
So like those unconscious biases that we have, like can actually negatively affect people.
Yeah, and it can now for me, I see that a lot because in my household, my son sees me as a doctor, and my husband, he's not a doctor. He has his own work. So when he goes to hospital, he sees women and he asks, "Is she a doctor?" And I really like that because I want him to know that men and women can be anything in that industry.
Exactly.
So which is really beautiful because he would be like, oh mama, like the one who treated me, was that a doctor? And I'm like, yeah, that was. And like it's really nice, the conversations, even though he's really young, I make this conversation and make him know that if he decides to be a nurse, he can be a nurse.
Exactly.
If he wants to be a surgeon, he can be a surgeon. Whatever. It's all up to him. But I feel like growing up here, because especially growing up, my mom had a lot of issues to deal with our relatives and things because they're like, oh, your daughter's going to Australia? Are you sure you want to send her to Australia?
And so young, right? You were young.
I was quite young. I was like 17.
And by yourself.
Exactly.
By myself.
I feel like you broke so many barriers like coming here.
Yeah, I had to. And I think my mom was the reason behind it because my mom was like, I trust my daughter and I know she's going to make all the right choices. And she stood by. And a lot of the relatives, you might know all this, but they'll just always like, are you sure no one's going to marry your daughter when she's so highly educated? And I'm like, I don't care. I know. So these were
not having this.
I know, these were the things that my mom would hear. She'll get calls when she's like, when she's all by herself in Sri Lanka, she'll be like, oh, you know what, this auntie called and said, this, and she really heard from me because I went on and on. I was like,
the audacity of these people.
I don't get it. Who wouldn't want a doctor in their family? Who wouldn't want to be married to a doctor?
That's the sad thing, right? There's a lot, like in our culture back in Sri Lanka, which is really sad. I know quite a few very bright, smart, intelligent women who's got degrees, but they're not allowed to work. So mom, that's what I was afraid of. And luckily, my husband, who was my sweetheart, he was like, no, I'm gonna get her. I'm getting married to a doctor. I don't.
And he's so supportive.
He's been the biggest support in my life, and I don't think I would have actually come this far if it was not for him. But the amount of pressure the society put on my parents to say, you guys are doing something wrong. No one's going to want your daughter's hand in marriage because she's going to be way educated than the boy. And I'm like, I don't care.
That sounds like a boy problem.
I know,
it's not like a man problem.
I know. But it's really sad. But that's what I'm saying. Even when I go home, on my breaks, this is what I would come across. There was a point I didn't want to go for weddings and stuff because my aunties will be like, oh, so how's your degree going? Are you done? I'm like, there's 5 more years for me to finish. Can you stop asking me this question? But I feel like when women decide to do something for themselves and breaking barriers, there's always that pressure from the society at the back. They're like, because I got married in medical school, and the pressure that I had was, when's the baby coming? When are you guys going to have a baby? Are you guys married? Why are you guys not together? When is the baby? It was literally constant to the point.
It's one goal after another to satisfy
and it's
someone
so
else.
sad that it's coming from women, right?
Mostly.
I know.
Why? Why are you like this?
I know. And it's really sad because you're like, you think you're doing this massive thing, but it's all coming down to the baby I'm going to produce.
Yeah, exactly.
To actually show my worth.
Yeah, you're just like a baby machine at the end of the day to them. That's your biggest achievement, not everything else that you've done.
And what's really sad is like there are really smart women out there who's done these degrees, and once they get married, they're kind of, ties down to it is you can't work. Yes, I'm proud, I have this degree, but you can't work. You're not allowed to work. And I'm like, oh, I was not taking any of that. And I'm super proud to say that my in-laws have been super supportive from day one. And I also have let them know that this is who I am, like, this is part of me. And that's what our kid fell in love with. And I'm not going to change that for anyone.
Absolutely.
So as long as my husband and I are on the same page.
Yeah, maybe we need like a rehabilitation center for this auntie.
For brown aunties.
And like create some goals for them to achieve, so instead of like talking about all this shit, and then they can
which is really sad, because in my head I thought I was sacrificing all this to become a doctor, but then back at home
it's still not good enough. Because you're only as good enough as getting married and having a baby. Those are the goals.
I know, but the funny thing is, I did I did my degree while I was being a good wife. I had these kids. And still there's this societal pressure of what is next.
It's never going to be enough.
Exactly. And I feel like that's where our kid and I, we spoke a lot initially, and we're like, you know what? As long as you and I are on the same page, we shouldn't let anything else affect. And that was very important. So I would honestly say, people, like, you go through a lot of these things when you do come to another country, you're living by yourself. It's not easy. But that pressure, it's sometimes we put it on ourselves. If you just let go and say people can talk whatever they want to talk and just focus, you get to the end of it.
Definitely.
Honestly, like what more do they want? Like, she's a doctor, she's a mom,
she's married,
she's
got
I know. Want her to be an astronaut? Go to like Mars
she's like
and
still
be a doctor there.
so young, and she's achieved all this, and it's still not enough.
I'm still like a very homely person, so I love to cook for my husband, I love to cook for my family, like that's who I am. But I feel like people have different ideations of women. So when they see me, they wouldn't kind of expect, oh, she speaks that, she'll actually say no to no. Whereas in some cultures they'll be like, you need to just agree when your husband says it's black, it's black, even though it's white. And I'm not that. We're not that. No, none of us are that. That's why we are where we are, right?
And it's so great that Shahid loves, like, is a homely person, and she loves taking care of her family. But if someone is not that person, that is also
that's completely fine. And I feel like if people don't understand that, it's like, what's the point? Like, that's what I'm saying. It's not an easy journey that women have come this far, because there's like, even now, like right now I'm working, and I'm currently on like maternity, like part-time, so I'm working just because my baby's only 9 months. But I feel like all these pressures that we put on ourselves, and when our training, like, oh, so how long are you going to be on part-time? I'm like, are you going to ask that from a guy?
A man?
A man? No, you're not, right? So it's things like that. There's going to be pressures around us wherever we go, but as women, we just need to lift each other up and just remind ourselves.
And like, we naturally grow a thicker skin, I feel like, compared to men, because we just have so much more getting shot at us
obstacles
that men don't have, and they don't understand it.
They don't understand it.
Because they don't have to face it.
And I think that's what is important is, while growing the thicker skin, you kind of realize what battles worth fighting.
That's the thing. So that's something we discussed before the podcast as well, because Shahi said she has faced racism in the workplace, and I think you will talk a little bit about that. And we were just saying, sometimes we realize that we can't actually fight everyone and every single battle for our own mental health sake. We kind of
we just have to choose which battle to fight with, because otherwise you end up being a very angry person.
And some things are not even worth like putting all that time and effort into, like fighting, it's better to just avoid them and just save yourself some, work on your mental health rather than helping someone else feel good about themselves or something like that. Alright, right, Shahi. Now that we spoke a little bit about like your journey, your medical journey, and your journey as a mum, and all of that, I just wanted to. I know I hate personally being asked this question just because I'm a woman, but I'm curious to know because you're a doctor and you're a mom of 2 kids, and usually as I don't know if you've listened to the podcast, but the first bit of our podcast is when Shonali and I complain about how hard our life is,
and that is without kids.
Exactly.
Yeah, that's exact. I feel like today we can't actually complain about
No,
it
we
because we've got
can't,
someone who's
honestly.
a doctor and who has 2 kids, so
Exactly.
nothing we can compare.
Nothing
complain about
compares.
would
No.
compare.
But
yeah,
everyone's
so.
battles are their own. You
No,
can't-
trust
yeah.
me, babe. Ours is nothing compared to you.
Yeah. I think we're just being brats and we're just
Yeah,
having first world problems
exactly.
here.
Yeah.
But yeah, let's talk a bit about, because there are people who, who's gonna get to where you are today, and they would maybe appreciate some tips and tricks on, how well you're, and you know what, it's okay if you're not having that balance, but that's something we would like to work towards, right? And you're not gonna have a perfect, well-balanced life every day. But let's talk a bit about what sort of things you do to have a balance in your life or to achieve a balance in your life.
So that's a really good question, and I'm not going to tell you that I have the perfect balance, right? Because it's not. It's what I was told by one of my senior supervisors was, each day you get to be the perfect mom, perfect wife, and perfect doctor, and you can't do all 3 at once. And I stick by it because some days I choose, my house is a mess, but I'm the mom to my kids. I'm going to bake with them, the house is a mess, I don't care. I do activities with them, and I am fully in it. Some days I'm the perfect wife where I'm like cooking for him, like, do things with him, plan date nights. And some days it's just about me and I don't care about the house. There's a pile of laundry. So yes, life balance is very important, but it depends on what you get to choose, because you can't be everything at once. And yes, you can try, but that's at the expense of your mental health. So
exactly.
Now that I have 2 kids, I've realized my biggest mental health issue is like when the house is messy, and that's something I put on myself. So what I do is, if I know like I'm doing activities with kids, I tell myself house is going to be messy, at least your kids are happy. So like these are little things that I choose on a daily, day-to-day thing, and
little give and takes.
And a house needs to be run by both your husband and yourself. It's not just on me. So like in a week I will be like, hubby, you need to take care of this, I'll do this. And I often don't try to delegate things I know he's not really good at, because I'll be like, I'm such a control freak. I'll be like, you didn't do this. So I'll take over and I'll literally tell him, you need to do, get the car wash, put the fuel, and get everything up. So things like that. You just pick and choose what you're good at. And when it
divide
comes to
and conquer.
Divide and conquer. And the hardest part for me is when I go to work, I need to kind of have a schedule on my kids. So what Arkid and I do is we literally be like, I'm not going to come here and say, oh, we got it all. Some days we're like, oh my God, that was a really hard day. I can't wait for the kids to go to bed. But some days we're like, oh, we've got a good hang of it. So the balance comes when you and your partner are on the same page and know that, we can get through little things and, we figure it out. So for us, bedtime's really hard, and especially if I'm working, I let our kid know, bedtime's at 6 o'clock, dinner's ready, you need to do everything else and put them to bed. And when I get back from work, sometimes it's like 6:37 in the evening, dinner's already cooked. So we kind of do certain things over the weekend. We prepare meals, we prepare big batches, and sometimes we take out. It is what it is. Sometimes we just take out and we're like, okay, this is a day. Like where mama is not cooking and dad also gets to have a rest.
You take one day at a time,
You take one day at a time. But one thing that I've realized I really lack is looking after myself. And this whole year I've had to keep in reminders of my routine, routine scans and pap smears and things like that. And I've realized as a mom now that I have 2 kids, I've just literally put them aside and like, okay, I'll deal with that later. I'll deal with that later. Until my GP one day called me like, Shahana, you have all these things that's due. You need to come in. And then I'm like, oh my God, I as a doctor advocate my patients and say, you need to do these things. But I'm not doing the same to myself. And it's really sad because most of these things are in place to prevent things progressing. Like it could be picking up a cancer, or it could be picking up something like blood pressure or diabetes. And these are like, we are in that age where if we don't look after ourselves, we're gonna get sick.
100%.
And I'm like, okay, this is why it's really important. So what I've noticed is, if I feel like I'm getting overwhelmed, I let my husband know. I was like, next week on this day, I need this time to, do my life admin stuff. Book my doctor's appointment, book for my hair color, like things that you actually do to look after yourself.
And you talking of pap smears, I think that is something, honestly, like personally, I didn't even know was a thing until I came here. And so many things, like you say, can be like found out at early stages if we actually take the first steps. Because I feel like in our culture, no one really talks. And like the most important like diseases that we talk about are like diabetes, blood pressure, cholesterol, right? Like those are the things we grow up hearing. And I don't hear about like women's health, none of
which
this
is really sad because things like cervical cancer and like breast cancer, they're very common in young kids, young women. And which is really sad because as a doctor myself, when I saw young patients, and here when I came to Australia, I'm like, oh, everyone's talking about these pap smears and things. Oh, I haven't had mine yet, and I had to go to my own GP and like, oh, you know what? The last time I had a pap smear was I don't know when, and I had to get on track and get on that little schedule, which is really sad because people don't talk about it.
So and I think the government here really pushes for it, which is great, right? So one of my friends said,
I heard
you said
about that for the first time. Once I turned 25. So this is pap smear. I've heard about it before. I've never heard of like people my age getting it done, to be honest, going in Sri Lanka. I never heard about this when I was in Sri Lanka, and then I came here, and as soon as I turned 25, I got a letter from the Australian government saying, oh, now that you're 25, you need to get this test done. And I'm like, what is it? I don't know. It sounds scary. I've been delaying. I haven't done it yet. And I have a friend that I met today, and I asked her if she's done it, and she's like, no, I'm so scared to do it. And then I was like, let's book it together.
So for anyone who's listening, so what we do with pap smear is now in Australia what we call as cervical screening test. So what you do is you actually get a little bit of you do a test to see if there's a type of virus in the cervix, if in anyone who has cervix. And this virus called the human papilloma virus, they found is a cause for 98% of cervical cancer. So which is why they, and the way the virus spreads is through, sexual activity and that is the main thing why people say after 25, if you've been sexually active, you need to do a test because you can have the virus. So, but the good thing for you there, Shiz, when I was like, when I remember when I spoke to one of my patients, you can actually do a self-test now. So if you talk to your GP, and because the pap smear is quite invasive, and some people, and this is very valid, don't like that feeling of sitting up next to a GP who you meet once a year and getting a test done because it is quite invasive. They put a little tube in and they have a look at your cervix and take a little sample or a swab. But now they've come up with this self-test that you can find on the website as well, and you can even probably talk to your GP. They give you a swab and with clear instructions on how to do it. So, and you can do it by yourself at home, or even the doctor's office in their washroom. Get the test and give it. So it kind of takes that pressure of, oh my God, this is an invasive test and I feel very violated, because it can be.
I think especially coming from our culture where it's very don't show anything of yours to anyone, It's like even things like breast examinations, it's just like, ooh, like don't talk about it, that's very private, that kind of thing. To have to do something like this.
That. So I mean, you should definitely talk to your GP, and even your friend who hasn't had it done, talk to your GP because it's a new thing that they've rolled, because they've realized so many young women don't come to it because they don't want that test. So
exactly, because it can be scary, and not people know what it is and how it's done. All these unknowns about it.
Just in general, when we do a pap smear, we put a little tube in and have a look at the cervix. Use a swab, like how you do a COVID swab, and then you take a swab out and to see if there's a virus or not. The difference between doing a self-test and a test with the GP is the GP might be able to take a few cells from the cervix as well and see the cervix, the cells are normal. But if your swab comes back positive, then you can go in and tell the GP to do these tests. So it kind of is a nice way to actually get the patients to have that feeling like, you know what, I can do my own test, and if it comes back positive, you know, I can go and schedule an appointment, because then that way at least you know you've done the right thing in the first step to it. So,
and how often do you have to keep doing it?
So when you do the test once, and if your test is negative, you don't have to do it for the next 5 years unless you have symptoms. So if you have symptoms, then obviously you go straight into a different type of invasive test. But you know, you do it, and for the next 5 years you're all good. So I feel like if you can, you know, prioritize that and do it, it's really
And I think also in our culture, like the thought of inserting anything in your like vagina is such a taboo, because it's like, you know,
how could you?
You know,
I don't want to know about it. I don't want
and like you
hear
could
about it.
break your virginity, because that is the most important thing, like as a girl apparently.
That's the status that you need to. But how sad is it that, you know, we worry so much about that, but
exactly, that's
cancer.
the thing. So like your status as a virgin woman is more important than your health, and like you finding out, you know, cancer and like treating that. That is, the status thing is more important than something like this. So I think it's like really a mindset change, and I really hope it, you know, this is what we've been advocating with our podcast as well, is just changing our brown mindsets that are so set in stone from our parents' generation to breaking that and coming to realize that there are way more important things, you know.
And if anyone's listening to this podcast, remember, if you're 25 and if you're sexually active and if you have a cervix, you need to talk to your GP and see, I'm due for a pap smear and I need to get one. If you don't want that invasive test, you could do a self-test here in Australia. But get on it, because I have seen very young people dying from cervical cancer. So
and even breast cancer, right? I think that's quite important as well.
So with breast cancer, what I tell myself, and this is how I remind myself, is to always feel my breast for lumps and bumps every day of the month while having a shower. And you need to feel, if you feel a lump or a bump, you just have to go to your GP, because it's so avoidable. Like, you know, breast cancer is so common. And it's our body. Who knows our body more than us? So just feel it. If you feel a lump, get it out.
And there's actually, like, I've seen stuff online where like they tell you how to do it. Because I didn't realize this, but you have to also feel under your arms, right?
Because your breast tissue actually comes from all the way up there. And because I'm a breastfeeding mom, I've had little bumps, and, you know, I've had 2 ultrasounds, and these are things that I keep in my mind on track, because I'm like, what if it is a cancer? You don't know. And now that I have 2 kids, I would never want to just take my health so simple and for granted. Because, you know, I have seen people with breast cancer in such a young age. I've seen women who have actually delayed their routine scans for like, okay, I'll do it in another 6 months, and they've literally had cancer. This is really sad. And they're like, oh, I wish I actually did go to my last scan, because I would have picked it up then.
Yeah, I think we have a very much like, you know, if we don't know about it, then it doesn't exist, you know. So I think this is like, I'm so grateful for my parents, because my parents are very big on getting their scans done every 6 months. Like they do like the full body scan because they want to know everything that's going on, you know. They're very on top of it. Whereas my mother-in-law, on the other, like if she's listening, she will know that we cannot convince her to go get a test done, because she's like, no, I don't know about it. I'm fine. I don't feel anything, so I'm okay. I don't want to know about it. If I'm going to die, I'm going to die. And I'm like, no. Like, the thing is, you can die. Like, okay, you drop dead, that's one thing. But you're going to suffer, you know? And like,
that's the sad thing. Because if you pick up like a stage 1 cancer, you do a small test and you remove the cancer. Versus if it's gone to a stage 3 or 4, you end up needing radiation, chemotherapy, and really horrible, side effects.
And those could have been avoided.
It's all
right?
been avoided. So I feel like,
and that's gonna affect like people around
you. That's the thing. It's not just you. It's not
and
just you.
And I feel like that's what's like, as women, we put ourselves last. We always try to fill with an empty cup.
Yeah.
And now that I am a mom and I'm working and I'm trying to juggle everything, I try my best to stay up. Like if I feel like something's not right, I call my doctor and I'm like, hey, I think I need to do this. Sometimes because we see the worst things in the medical field, we kind of get that anxiety at the back as well. Like we need to be aware of that. But also I feel like I'd rather know than not know.
You'd rather be paranoid and be safe than
just like, oh, I wish I did that. Yeah,
definitely. And you also mentioned like it's important to be aware of your children's bodies as well when they're very young, right?
I feel like that's really valid, Shana, because us growing up, like our kids, we know them from their tippy toes to their head, and certain little, like, because I'm working with the kids now, I know that little changes you could see in your kid if you actually pay attention. I'm not saying that you need to go and microanalyze and examine them every day, but when you're giving them a shower, like have a feel of your bones, like do they say it's painful, like do they have any lumps or bumps under their arms, has this bump been there for too long, like these are things that you need to keep in mind. And I think what I've noticed is, compared to Sri Lanka, here at least you've got one GP and you go to them with everything. Me, when I go to my GP, I tell her my hat of a pediatric doctor is off. I'm a mom, I'm paranoid, please help me, because I'm very vulnerable. But in Sri Lanka, I noticed that they don't have a regular GP. They will jump from one doctor to another. They don't trust the medical system there. They will just be like, oh, that doctor said medicine first, so I don't like him, or this doctor will give me antibiotics and I feel better. Like, they always do doctor shopping, which is, I don't blame the patients, because sometimes doctors don't spend enough time in Sri Lanka communicating with the patients. They are like, they've got that superiority complex. Back in Sri Lanka, we're like, I'm a doctor, you listen to me.
I know everything,
which is completely very different to here. Whereas here, it's a very joint decision. Like, I remember my son needed a scan, and she came to me, like my GP came to me, and I was like, Shahana, what do you think? I think they need a scan, but do you think, are you happy with it? And it's a very joint decision, and I'm not made to feel bad for second guessing. Whereas in Sri Lanka, they're like, oh, the doctor said so, we have to do it. No, I always tell my patients, ask questions. No one can advocate for your kids apart from you, because they don't have a voice to tell and say. I'm like if my son needs something, I'll advocate as hard as I could as a mom, because no one else. And like sometimes I take that hat from our kid as well, because he's non-medical, and I tell him, if you feel like I'm overstepping, let me know. But right now I've got the mom brain and the doctor brain, and I'm like, I need everything done. So
and that's your job as a parent too, to advocate for your kids.
So I honestly say, parents, moms, if you have little kids growing, have a feel to them and take what they're saying like to head. If they say they've got a headache and it's been a few weeks and you kind of feel like it's getting worse, get it checked. If you feel like your kid is asleep and like always sleepy and not very lethargic, very lethargic, get it checked. Because sometimes we kind of put, they're growing pains, or how we these are normal pains, but sometimes it could be something underlying.
And also I think, like, especially coming from Sri Lanka, like a lot of people will have opinions. Like if you say, oh, my child has this pain, like someone will be like, oh, it's probably this. So it's, I feel like you need to be like, no, this is my decision.
For your child, and have one person that you go for medical advice. Do not go to Google. Do not, because having that one person, that person will be like, oh, you know what? Last week you came and said he has a headache, and today he has eye pain. Could this be something with that? Because if you don't go to the same doctor, they you are going to miss things.
That's true.
So
And it's okay to get it wrong sometimes, because getting it wrong is better than not investigating it.
And sometimes like doctors are not superhuman. Like we get things wrong as well. But I'd rather than say, oh, you know what, we freaked out, we thought it was a bad thing, but it's just, he's got, something like, he's short-sighted, or that's why he's headache. Compared to, does he have something in his brain? You know what I mean? So I feel like it's a give and take, but as long as you learn to trust your doctor and the doctor gives back that respect and you have that mutual relationship, you've got to go.
And sometimes it's okay to trust your instincts, right?
Yes.
They're there for a reason, and you know.
And question your doctors, question your medical professions. Like, the more you question, sometimes that might like light a bulb in your head as well as a doctor. Like, oh, I didn't think of that.
Think of it. Yeah, absolutely.
Okay, we need to start questioning our doctors.
Don't say I said that.
Yeah, true. I agree.
You need to Google your symptoms and then be prepared for it, and then go to your doctor.
Yeah.
Do not Google symptoms.
Google is not a doctor.
Do not go to Google.
Do your research.
So we've been talking about taboo topics, that are not really discussed in our brown community. And I think one of the very important things is a period, So I feel like growing up, like, periods were not really discussed much when we were younger, and then when we finally get it, it's like celebrated, and there's this big drama about it.
All of a sudden, you need to tell everyone about it.
I know, right? You have a big freaking party where everyone gives you gifts and all this, and then all of a sudden, no one talks about it again, and it's like you have to be ashamed of having a period, and like if you're buying pads or whatever, you have to hide it, and like you shouldn't show it, like the way you dispose it has to be. It's like this irrational, ridiculous thing in the brown community that just makes no sense, right? But then because we hide it so much, we just don't realize the importance of your period, and having a period is so important and healthy as for a woman. And then the people have a lot of problems surrounding your period. Like, some people have really intense pain, but then if you tell like a brown auntie or like a doctor, they're just like, oh, that's how it is. That's just
suck it up.
Normal. Like you just have to deal with it. It's just a normal part of being a woman. But sometimes it's not a normal part, right?
So I'm going to talk, like, I am a pediatric doctor. I'm not a gynecological doctor, but I have worked in the emergency department where so many women come in and saying, I've had the most worst pain during my menstrual cycle. And can I just say, you don't have to live with it? You don't. If you have what we call PMS, the post-menstrual syndrome, where you actually have pain a few days leading to a cycle or during the cycle, that is not normal. Yes, a little bit of cramp is okay. Like, you get a little bit of pain, but pain to the point where you don't go to school, you have to stop going to work, the migraines are hard. That is not normal. So I would say, if you have these symptoms, you need to go see your GP. You don't have to live with it. You don't have to put up with it, because that's not normal. So I honestly, as a mom, I feel like, because I always needed to be on track with my periods, because I need to follow it, because I forget. I'm like, oh, when did I have my last period? I would probably like go with my husband, like, was I moody 2 weeks ago? You know what I mean? But I use an app called Flow, and that kind of tells me when to kind of expect the period and things like that. But one thing I think young generation, especially young women, need to know is your period is very important to you. Your period can tell you, is it healthy or not? Your menstrual cycle should be very regular. If it is not regular, there's an issue with it. And like, I sometimes see patients, they're like, oh, I've not had a period in 6 months. That's not normal unless you're taking contraceptions or you're wearing something that actually prevents you from having it. So I feel like, yes, as you said, Shahana, like, at one point in our life, they glorify attending age and, giving jewelry and say, oh, my daughter's a big girl now, to the point where you come to one age and they're like, don't talk about it.
Who invented this?
I don't know. I did not comprehend.
I know. And they're like, please don't talk about it. Like, it's really sad. Because, but I was, like, when I grew up, menstrual cycle was not something that we avoided. My mom openly spoke to us about it. My brother knew about pads. My brother knew when to bring a pad. And like, I would just say that, Nana, can you bring pads? And he'll just openly go bring it. But the uncles would close it with the paper and all that.
That's what's needed, right? Because that is why this awareness about women's health is so important, as much as men's health, actually. Because, we live in a society that's, we communicate with each other. We how do you say this? What's the word to we coexist in a society with all of these people. So as a human, it's you need to know about the other person's health and what they go through. You're gonna have to know this to help your mom, your sister, your partner,
and the thing
girlfriend.
is, we all exist because someone got a period, right? Which is hilarious.
And I honestly think, like, when my husband goes into my doctor's appointment, he is so instinct, and he'll sit down and he'll ask, why is she getting these symptoms? Why is this? Can we do this? Like, he's so involved in these decisions. Like, even when I was pregnant, like, he was so involved. And I feel like that's because growing up, he knew what a period was because his mom and his sister was there, like, you know, and he was so proactive in that kind of sense as a brother and as a son. So I feel like it starts young. My son is definitely going to know what a menstrual cycle is and what we use, and, you know, and it's not going to be a taboo topic for us because I'm going to make that decision. But the sad thing is, some kids, like in some women, will grow up to be like, oh, I never speak about my menstrual cycle. But, you know, there could be so many different things that can happen with it. Some people get irregular spottings, they get the painful periods. Some people get this really bad odor during their menstrual cycle. And the more you push it away, people, like especially women, suffer alone. And I don't think that should be the case. I feel like if anyone's listening to this podcast, like if you feel like you've got pain, and if they're extreme pain, and if you feel like you've got migraines and, you know, it's debilitating, go see your GP, because some people could be put on medications to avoid that, and you don't have to put up with it. And if someone says, just have some chocolate and get over it, you need to get rid of them.
And boys, if you know someone going through this, encourage them to go see a GP, or take them with you to go see a GP.
Yeah, because that could be a sign of PCOS. So PCOS is polycystic ovarian syndrome. It's very common. 1 in 10 women has it. And sometimes you don't know what the symptoms are, but some subtle symptoms could be women have hair on their face, their you know, sideburns, and different areas where you wouldn't have hair. And the reason why they have that is because there's an imbalance between two hormones. One's called insulin hormone, which we all know about, and the other hormone is called an androgen. Androgen is a male hormone. So when there's a disbalance in that insulin and that male hormone, you actually have features what males will have, like, you know, that's why you end up with a lot of hair on your chin and your, you know, like a beard, and, you know, sometimes we call that hirsutism. So I noticed that people will be like, oh, I've got this hair, I'm going to go bleach it and remove it, but you're not trying to figure out why you have it, the actual root cause. So if you think that you've got issues with acne, hirsutism, which is hair, in places that you would not normally see hair, if you feel like you have like other signs are like, you know, you can't lose your normal weight. I'm not talking about diet culture. This is just what's your healthy weight, and you can't seem to lose it even when you're, you know, eating healthy and doing exercise. There might be something wrong. So something like PCOS. And sometimes women realize they have PCOS when they're trying to have kids, because PCOS can cause infertility. So I feel like if we learn about these things at a young age, like I knew about this because I went to medical school, so way before I had my kids, I was like, I need to be on my correct weight, I need to do these exercises, I was making sure my husband was healthy, and I went and got scans on my ovaries just to make sure, you know, it was all healthy. And I feel like the more you are educated, you can advocate for yourself and not wait until you're, you know, you're deep down it and you're like, why can't I have kids? And, you know, all. I'm not saying this is the main reason, but people often find their infertility issues are because of PCOS way down the lane. When if you realize your body was, you know, showing these subtle signs early on, and if you're knowing your body, I feel like it could have been something that we could have worked on early on.
Yeah, absolutely. And I think there's like a big focus, you know, these days around self-care and self-love and that kind of thing. And I feel like, I mean, that's amazing. That's what we need. But sometimes it tends to be on the like surface level, which is like just massages and spas. Whereas like if you can, I mean, those are absolutely really important, but if you can set yourself like a day to be like, I'm just gonna go like a layer deeper and get all these things tested, like,
and don't delay your doctor's appointment. Like I feel like just go to the doctor, even if you don't know what you're going to talk about.
Exactly.
They will go through certain questions, especially your GP. Because we are taught that if a 25-year-old walks in and it's a female, these are the questions we need to ask. Are they smoking? Do they drink alcohol? Is it healthy? Is it not? So we do these preventative things, and we make some decisions that we're like, oh, you know what? By the way, you are eligible to do these tests. Do you want to do it? So it's just a matter of making that call, and it's not on you. Especially in this culture, especially in Australia, I've noticed a lot of responsibility lies on the doctor and not the patient. Whereas back in Sri Lanka, I've noticed a lot of the patients carry their books, their x-rays, and they need to book the appointment. They need to do that. Whereas here, everything is done for them. Yeah. So, because we are living in Australia, we need to take that as like, oh, you know what? Just make that appointment, go to the doctor and see if you're up to date. Like, my husband is really bad at looking after himself, so I book all these doctor's appointments, and I'll write a list and say, you're this, I need you to go and talk to. And these doctors are really nice. They're like, yeah, you're eligible for these, let's do a blood
I think
test.
her love language is acts of service. We discussed this.
That's what I thought.
That's a different type
Oh, that's really nice.
Yeah. But I feel like in my head, if we don't do that to ourselves, who else is going to?
Absolutely.
Yeah, exactly. You need to be the driving force of your health.
Yeah, exactly.
Because it's at the end of the day, you owe it to yourself to take after yourself and be conscious of, and be more aware of your body. And we don't necessarily, we're not encouraged to do that growing up in our culture, but it's something
and also
important.
because we spoke about fertility issues, because you have fertility issues in your marriage and you're trying to have kids, don't just always think it's the woman's fault. It could be a male's fault.
Exactly,
You get your husband to go and check the sperm count, because there will be very lazy ass sperms there. So what I'm saying is, like, it's not just about only a woman's fault or her problem. It just definitely that's why I think it's really important to be involved. Like, I'm involved with my husband's health, my husband's involved with my health. So we just make that work together.
So I feel like we've discussed a lot of very important things, and I think our viewers will agree that it's been a very informative session, and we are very grateful that you could. I know, like, she's so busy. Honestly, I know how busy she is. But as soon as I asked her, she agreed to come and do this. So I'm so grateful for that, Shahi. Thank you so much. And I think something I should also mention is Shahi has her own Instagram page, which is Dr.Shahana. Is that right?
Yes, it's a very, very small.
Yeah, but still, it's very informative. I mean, I follow it even though I don't have kids, and I'm always like, wow. So it's like Dr. DOCTOR, like the full word, .Shahana. So if you've got kids, or if you just want to be, in the know and know things, definitely give her page a follow. And if they want to message
what that page I just have for just to share what it's like to be a mum, a pediatric doctor, and have kids. And I show, and I whine a lot as well. I complain about my kids and work. But it's a page that I actually have as to be accountable for my day. It's really nice. But I also share certain things I come across at work, like certain things. Some parents don't know, don't do this, don't do that. Like, I come from there. I cannot give medical advice through the page, but as a general, I do share some good information, fun stuff to do with kids. If you have toddlers and kids, but it's a page that I just run very brief. We're very small with my friends and family in particular, but I do share medical stuff.
I think it's very important, and I've learned a lot as me working with kids. Some of the activities that she does with her own kids, I actually do with my kids as well. So definitely that's really important. So if you want to give that a follow, definitely do that.
Yes.
I think we'll have Shahi on another episode, I think, because we have so much to talk about. I know, I don't even feel like 1 hour went.
I know.
It went really fast.
I feel like we learned so much today, and I feel like I've definitely learned heaps.
I had fun talking to you girls.
Definitely.
Thank you for having me.
Yeah, and if you've got any questions, you can direct it to us, or you can direct it to her page, and I'm sure she'll be more than happy to answer.
More than happy to answer.
Yeah.
Whatever that's in my scope.
It's been such a very informative, such a very fun episode. Thank you so much, everyone, for tuning into this episode today. And if you've got any questions, comment in our YouTube comment section, and we can we'll do our best to help you, and we'll direct you to the right people if we can't answer them. So the takeaways from this episode is to put yourself first, book your pap smears,
book your
ladies,
paps, girls,
and then book all your tests, medical tests, and get them done.
And be more aware of your body. You know, there's no shame in your body. There's no shame in your period. There is no shame in being sexually active. These are all just a normal part of being human.
And part of who you are as a woman. You should be proud of it.
Absolutely.
Embrace it.
Absolutely.
Love it.
Embrace it.
Yes.
Yeah.
Okay, guys. So I guess we'll see you next week then with another episode.
Exactly. Yeah.
Cool. Take care, everyone. Bye.